So now we're going to dive into the last myth that I'm going to be covering today, and that's going to be myth number 3, or on this third video, and can I enroll in Medicare anytime? I mean, hopefully you haven't thought of enrolling into Medicare just anytime, and you're just kind of putting it on the shelf and going, when I decide to do it, I'm just going to pull it off the shelf and then do it. That is the wrong mindset, and what can happen out of that, the problem with that is you're going to all of a sudden realize you're going to face higher cost and then late enrollment penalties. And we're going to be covering that today with you and eliminating the myth that you can't just enroll in Medicare whenever you want. So one of the big talking points around Medicare is what they call the initial election period. And if you're turning 65, Medicare has benchmarked this time period at 7 months totality, as far as 3 months prior, the month of, and then 3 months after. I call it like the 7-month window that you have to enroll or choose a Medicare health plan option when you're first becoming eligible for Medicare on Part A and Part B. Now, if you decide to stay on an employer-based plan and the employer-based plan has 20 employees or more, you don't even have to take out Part A and Part B. When you do come off the employer-based plan, you have an election period, a special election period you can enroll. But during the initial election period, these are for people, let's say you've been self-employed, you've sold a company at 60 years of age, you're turning 65, and this is the eligible window of when you enroll into your Medicare Part A and Part B. Everyone becomes eligible for Medicare at the age of 65. The only people that don't enroll is those that have an option to not enroll because they're on an employer-based plan or a spousal-based plan with their spouse, and they have coverage, and the law or Medicare rules says, hey, you don't have to enroll right now. Everyone else that doesn't have insurance and are turning 65 and became eligible for Medicare, if you don't enroll during the 7-month window, in general, you're going to suffer penalties later on when you try to enroll. So it's very important for you to realize, if this applies to you, if you're at this situation where you're going on to Medicare and you deny Medicare or turn it down, or you get your card in the mail and you send it back and say, I don't want Part B because you don't want a Part B premium. Part A, you're going to be paid for in full. It's an entitlement portion of Medicare. If you've worked 40 quarters or 10 years or longer, then you qualify for Part A without any cost. Part B, you're going to have a Part B premium based on the year that you're in. You're going to pay the premium to have Medicare Part B. And sometimes people, educated people, doctors, that are self-employed doctors that don't have group health insurance, they'll a lot of times, because their Part B premium is much higher because of their earned income from 2 years ago, the IRMA scale tells them, hey, instead of paying a standardized Part B premium, you're paying a much higher premium, and they get frustrated because they feel like they've worked for Part B. Well, you've actually worked for Part A that you're entitled to. Part B you pay for. And so if you choose to turn Part B down, guess what? You're going to pay the piper of 10% penalty year to year. So it's a 12-month period, and it's a 10% penalty added to your Part B premium for what you owe when you do decide to enroll into your Medicare, and we'll talk about that here in a second. But that initial election period is a 7-month window with your birth date month in the middle. So 3 months prior, the month of, and 3 months after. The possibility of penalties for late enrollment, we're going to talk about that and just kind of let you know what happens if you don't do a drug plan. Let's say you enroll into Part A and Part B of Medicare, you're just on original Medicare, and you're like, I'll just enroll and whatever, I'm not going to choose a plan. I don't want to mess with it, I'm retiring, it's frustrating, it's complicated, and I'm just confused, and I'll just go on original Medicare and leave it be. And you decide not to enroll during that 7-month window into a drug plan. Well, guess what? When you decide later on that you're wanting a drug plan, you're going to have a 1% per month accrual penalty, and it's going to be based on the National Prescription Plan Drug Premium Average, which usually runs around $30 to $40 a month. So you're going to have like this 30-something cent or 40-cent penalty for however many months. And we've had people that go for 48 months, 60 months times that, say 40 cents or 30 cents, could be $18 to $24 penalty added on to the premium cost of their Part D plan. Or they enroll into a Medicare Advantage plan and they say, hey, I've been put on this medication, I've been healthy, I chose not to go into insurance coverage, I just had Medicare A and B, I've been to the doctor 2 times, the last 10 years. I just didn't see the need for it. Now I'm enrolling into a Medicare Advantage plan with a prescription drug benefit in it. Guess what? That penalty again, that percentage amount per month, however many months, is going to be added back into or charged to you. You're going to have to pay the penalty. So you need to be aware of that. The other thing is, you're going to have this thing called the general election period. If you choose to turn your Part B premium down when you become eligible, and you need to know, depending on your situation, when you are eligible and when you can eliminate the penalties. That's why we educated on this in a lot of different videos, but you need to be aware of that. If you don't know and you have questions about it, set a time, call and talk to us. Talk to somebody who knows what they're talking about to explain the potential for penalties. You don't want to be penalized. But if you wait and you choose to enroll in your Part B during the general election period, that's going to be from January to March the 31st. When you enroll, whatever month you're in, January, your Part B would start February 1st. Well, you're going to have this 12-month period that you did not, or 24-month period that you did not have Part B. You're going to be charged a 10% compounding penalty per 12-month period time. So if you have 1 year, 2 years, 3 years, it'd be 10, 10, 10. It compounds on top of the Part B premium. So then you have to calculate that and say, now I'm going to have to pay the Part B premium in addition to this penalty or penalties, depending on how many years you went without your Part B. So you need to be very aware when coming off an employer plan, when going into Medicare, when your friends and family begin to tell you what you should be doing, and really they're not educated to guide you through what the options are. They mean well, but they don't know a lot about the Medicare space. And especially most of the time, if you're like me, we're very superficial and shallow with the information we provide family and friends. So we're providing a little bit of information, and then their knowledge of that is, they think they're very deep in their understanding of something, and they give you all this information, and you take it on because, well, Uncle Bob is super successful in business, so he's got to know what applies to my situation, and that's just not the right way of looking at that. That would be like you coming to me and asking me for medical support, me putting on a doctor's coat and stethoscope and saying, sure, I'll be your doctor for the day. That would be a disaster for you and a disaster for me. Don't always trust your friends and family and try to educate you. Make sure you're talking to somebody that knows what they're talking about to eliminate your cost and potential penalties. Guys, that was video 3 on the myth that you need to be able to understand. These 3 videos, if you didn't watch video 1, video 2, and myth 1, myth 2, go back and watch those. And guys, we'll be providing some other great content here in the future, and I'll see you on the other side. Have a great day.